Now, systemic issues in Australia's healthcare system are under scrutiny. The National Women's Advisory Council has been formed to investigate why women often suffer poorer treatment and delayed diagnosis. It's become known as medical misogyny, and it applies especially to indigenous women who say they also face social and racial prejudice. Roger Maynard reports.
At her home in Nowra on the New South Wales south coast, Professor Juanita Sherwood ponders a lifetime working on the front line of Aboriginal health and education. Academic, registered nurse and proud Wiradjuri woman, she's spent more than 30 years dealing with the disadvantage suffered by Australia's First Nations people.
There's been over 200 years of devastating policy that's impacted on our health and well-being, physically, mentally, emotionally and spiritually.
The inequality between white settlers and the people who've lived here for around 65,000 years continues to manifest itself in outback communities, where Aborigines have a much lower life expectancy, a greater child mortality rate, and poor access to clean water and hygiene. Women in particular are at risk, especially during pregnancy, where a shortage of facilities and a lack of understanding of Aboriginal culture by some members of the health system add to the suffering. In the country town of Walgett, in far west New South Wales, there are 2 hospitals, but babies still have to be delivered a 3-hour drive away at Dubbo.
Once they're taken to Dubbo to have their baby, they are released from the hospital. The baby is taken out in a capsule and then removed from the capsule, and they've got to find their own way home, which is really sad, you know. Particularly if you've got a mum with another 3 or 4 kids at home.
It's not only people of colour who are affected by so-called medical misogyny, but it's certainly worse for them, according to human rights lawyer Professor George Newhouse.
Well, look, if there's medical misogyny, then the intersection of race and gender means that the outcomes are even worse. We see cases of a lot of misidentification. We see Aboriginal women having much lower weight babies than non-Indigenous women. We see Aboriginal women with 27 times the rate of diabetes, but also the approach that First Nations women have to actually going to a hospital and seeking out care are determined by the prejudice that they expect to receive at the healthcare provider. There are statistics out of Victoria and out of Queensland in Australia which indicate that Aboriginal people believe very strongly, more than 50% believe they're going to get a lower standard of healthcare than non-Indigenous people.
Professor Sherwood agrees that an underlying distrust of the medical service by Aboriginal people who view their well-being from a different cultural perspective only adds to the problem.
Our health is holistic. We don't want just a mainstream approach to our health and well-being, but we do require respectful encounters and culturally safe experiences in the health setting, because you keep going and getting bashed up by, growled by nurses and doctors, you don't want to come back. And if you don't, and if that's your way of experiencing that healthcare, why would you want to go back and get better? I mean, is that going to help you? No, it's not. It's actually going to undermine, and that's part of our health-related problems.
While medical misogyny can be a problem for women generally, it's clearly a major issue for Australia's First Nations people. The challenge now facing Australia's National Women's Advisory Council is how to promote better health care for women of all ages and all cultural backgrounds. Roger Maynard, CNA, Sydney.